The danger from us walking back our leadership in vaccination is that those diseases, measles, rubella, polio, will increase globally and be more likely to come into the United States and cause illness at the very least, but also death. My name is Matt Ferrari. I'm a professor of biology and the director of the Center for Infectious Disease Dynamics, and I study quantitative population dynamics and quantitative epidemiology. President Trump's new proposed budget includes large cuts, up to $280 million, in cuts to the Centers for Disease Control's Global Health Division. And that covers a huge range of activities, including support for vaccination for polio and measles and a number of important vaccine-preventable diseases around the world. But it also includes cuts for global surveillance networks to help us understand where diseases are, where viruses are all around the world, as well as cuts to things like malaria prevention and HIV prevention, right? The argument here is we should be cutting these things to focus funding and focus support on domestic issues and domestic health. But the truth of the matter is that America is a global country and we have interactions with people from all around the world. So indeed, keeping the globe safe and keeping the globe healthy is part of keeping America healthy. And particularly, infectious diseases are critical here because they can be transmitted and transported by people coming and going. We have a measles outbreak in the United States right now. All of the measles outbreaks that have happened in the US for the last many years all started with an American going abroad, getting sick, and coming back and bringing it back, right? So in all of these cases, right, keeping people healthy and reducing these diseases elsewhere is a huge part of keeping Americans healthy and America safe. So emerging infectious diseases that we've seen over the last many years, the Zika virus pandemic, monkeypox, or what's now called Mpox, the SARS-CoV-2 pandemic, right? All of these cases, right, US experts were brought in first. And so we were part of the initial response. And the reason we were the first choice was because we were the global leaders in science and innovation and translation out to the distribution of public health response around the world. If we're second or third in line, right, then that means that we find out later, we're behind the ball, and we have to follow somebody else's choice. We can motivate our investment in global health because it is the moral and right thing to do. It is helping other people around the world. We are using our success, our leadership, our strength to help others, right? That's absolutely something that I strongly advocate for. But that is also aligned with our selfish intentions, right, and our selfish need to keep Americans safe, right? And so this is again one of the public health leadership is one of the rare times where we get a win-win situation where doing the selfish thing is also the best thing for the world. And so to step back from that, I think, is an absolute tragedy for the United States and for the world at large.